Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head-on. I'm your host, Joe Koh, Director of Therapeutic Area Growth and Integration at the Global Healthy Living Foundation, and also President of GHLF Canada. For today's special episode, I'm at the European Headache Congress in Barcelona, Spain. I'm here with a very special guest. Can you introduce yourself and state where you're from?
I am Miguel Lainez. I am Chairman of Neurology and Professor in the Department of Neurology in Hospital Clínico, Valencia, Spain.
And we're here today at the European Headache Congress. From your perspective, what are some of the most interesting pieces of research or discussions that are happening?
Well, I think there are many things interesting. This morning we have attended a session interesting about the medication overuse. Now we have a session on vestibular migraine. I think many topics are interesting, and maybe the most important is that there are the results of the last studies with all the new drugs, the monoclonal antibodies, the GPANs, lasmiditan, all the new compounds, and even some devices as a review. Very interesting forum of discussion with the friends and colleagues about the new ways to improve the quality of life of our patients.
That's so important. What were some of the takeaways from the medication overuse headache discussion and the vestibular migraine discussion?
I think it's important that the patients are conscious that the overuse of medication can chronify the migraine. And for this reason, it's important that they restrict, as can it's possible, the use of acute medication. But I understand that you have severe pain. It's impossible to maintain this position. But fortunately, we have the new medications, especially monoclonal antibodies, have very good data about how the medication overuse can be reduced with the new treatments. And I think this is very important. And years ago, we thought that the preventive medications don't work in the case of overuse. No, we know very well that these medications work even in this kind of patients.
So is it safe to say that the newer medications don't cause medication overuse headache like some of the older acute medications did?
Yes, I think that the new, especially monoclonal antibodies, works very well even in this. Previously, the botulinum toxin was in this medication, and even there are some data on topinamide. I think the important thing is that it's a combination, the management of the medication overuse, a combination of education, aptitude of the patient, knowledge about the problem, and use the correct preventive medication.
And you mentioned a talk about vestibular migraine. What was a takeaway for our community to learn from that talk?
I think it's important that the patients lose the feeling of stigma. I think it's important to live better with the disease. It's important that they are conscious that they have a normal disease. They are not the reason. The reason because they are migraines is the reason because other people have another conditions as arthritis or asthma or similar. And it's not a problem of the patient, it's a problem of the disease. But no, probably many patients think that the problem is themselves, but it's not themselves, it's the disease.
Well, thank you so much for your time, and I really appreciate the information that you shared with our community, and look forward to the rest of the conference.
Pleasure to be here and then to share these opinions with your community.
Thank you for listening to this special episode of Talking Head Pain, the podcast that confronts head pain head-on. If you have any questions, thoughts, or suggestions for us, you could send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. I'm Joe Koh from the European Headache Congress, and I will see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.